Now, everyone in Oklahoma knows that we have been at the bottom of our health rankings. Medicaid expansion was an option in the Affordable Care Act. The Affordable Care Act passed March 23, 2010. Almost after a decade of trying to get this done at the state capitol, literally, we put it on the ballot to let the voters decide. We knew it's the right thing to do. We knew that we had over 200,000 hardworking Oklahomans who didn't have access to health care because either their business didn't offer it or they have 2 or 3 part-time jobs.
Access to care, I think one of the best ways to understand it is if you don't have someone an insurance product, which is what Medicaid is, it's just government funded instead of privately funded. If you don't have access to care, when you call to make an appointment at a doctor's office and they say, yeah, please bring your insurance card with you, you say, well, I don't have insurance, and the person on the other end of the line says, then we won't be able to see you today, then you can't get in to manage your care. So a large percentage of our population has diabetes. Diabetes requires routine management. You can't do that by going to the ER. We can't manage their health for them. I can talk to what we've seen in our own market, which is in southwest Oklahoma and Stevens and Jefferson County. And we've watched our Medicaid, the number of patients presenting with Medicaid grow and the number of patients that we're taking care of that are uninsured decline. So for those patients, what's that meant is they can get the care that they need to hopefully stay healthy and be productive citizens.
It's important to note, before we had Medicaid expansion, Oklahoma hospitals were forgiving over $500 million of care every year. Oklahoma, since July 1, 2021, has been able to draw $9 federal dollars for every $1 appropriated back to Oklahoma.
I'm really proud of what our organization accomplished, and I was fortunate to be the chair the year that State Question 802 was pushed through. Sometimes it's just great timing. So I was really proud of what we did, and really our whole team. I think the Oklahoma Hospital Association was positioned at the right time, at the right place, to really help be a catalyst to get that done. Our hospitals needed it. It has helped our hospitals financially, which it's always hard to talk about dollars when we're talking about taking care of people, because we all want people to get the access that they need and to get the health care they need. But unfortunately, it's expensive. And Oklahoma hospitals, we had seen several closures within 5 years of that passing, and we haven't seen one since. And funding does matter, and when you have the right funding, you can accomplish a lot.
The Oklahoma Hospital Association is very successful when we build coalitions with others. We knew that we would have a big job to go collect signatures, and it would be not only hospitals, but our other dedicated partners, and this included nurses, doctors, tribal members, community advocates, business leaders, when we had to go out and start collecting signatures to put this on the ballot. We have CEOs with clipboards at car shows, at county fairs, and they were hitting football games trying to collect signatures, and our CEOs had their staffs engaged. Hospitals typically in any community, if not the top employer, they're in the top 5. And these folks are not in these roles if they're not leaders. They were also standing up in front of Rotaries and Kiwanis and Lions Club, school boards, explaining what this would mean to their local community and putting a human face on it. That is what OHA cannot do. So we did educational sessions for our members. We checked ballots out here. We ferried yard signs all around the state. Literally, we were a hub for our members.
The Oklahoma Hospital Association, at its core, is here for the people of Oklahoma. When we meet, we talk about the issues of the state and how can we improve the health care of the people that live here, because that's what all of our missions are. And it's a commonality that hospitals share, and it's the reason we're all proud to serve on the Oklahoma Hospital Association's board.
I know that we talk about, how important healthcare is, and let's just be totally frank. People don't want to think about healthcare until they need it. And they want it to be close, and they want it to be stellar. And that takes tremendous dedication